This presentation is on Wilson's disease, presented by Shana Nadeau. Wilson's disease is a rare autosomal recessive genetic disorder of copper metabolism. In order to develop this disease, you must inherit 2 copies of the defective gene, one from each parent. If you receive only one abnormal gene, you won't become ill yourself, but you are considered a carrier and can pass the gene on to your children. Wilson's disease causes the body to take in and keep too much copper. The copper deposits into the liver, the brain, kidneys, and the eyes. The deposits of copper cause tissue damage, death of the tissues, and scarring, which causes the affected organs to stop working correctly. This disease affects between 1 in 30,000 and 1 in 100,000 individuals. For every 200 patients diagnosed with this disease, at least one will carry 2 genes mutated for hereditary. In 1912, Wilson's disease was considered a syndrome. During the past 2 decades, there have been major advances in understanding of the pathogenesis, cellular biology, and molecular genetics of this disease. The severity of the symptoms may vary between patients diagnosed with Wilson's disease and evolve over time. Many of the symptoms are often indistinguishable from those of other liver diseases, such as hepatitis. Some of the symptoms are fatigue, lack of appetite or abdominal pain, jaundice, which is a yellowing of the skin and white of the eyes, a tendency to bruise easily, fluid buildup in the legs or abdomen, problems with speech, swallowing, or physical coordination, uncontrolled movements or muscle stiffness, Kaiser-Fleischer rings, enlarged liver, and behavioral changes. Blood and urine tests are conducted to monitor the liver function and look for copper in the bloodstream. Blood can be tested for the level of protein. The protein which carries copper in the bloodstream is most often low in Wilson's disease. The urine is tested to measure the amount of copper excreted in a 24-hour period. If there are neurological signs and/or symptoms, a doctor may request CT or MRI tests to see how the disease is affecting the brain. An eye exam may be conducted to check for golden brown discoloring that are caused by deposits of excess copper in the eyes. A liver biopsy may also be conducted and tested for excess copper. And lastly, genetic testing can identify the genetic mutations that cause Wilson's disease. Genetic testing is often done after other testing supports the diagnosis of this disease, or when other tests have inconclusive results. Receiving an early diagnosis of Wilson's disease before debilitating symptoms occur and beginning treatment as soon as possible is imperative in a person's quality of life. Medications called chelating agents prompt organs to release copper into the bloodstream. The copper is then filtered by a person's kidneys and released into their urine. The most common drugs for Wilson's disease are penicillium and triatine. Side effects range from skin problems to bone marrow suppression, and in some cases worsening of neurological symptoms. Zinc may also be recommended for patients who have been successful with conventional treatment. Zinc could help maintain a healthy copper level and has very few side effects. My case study was regarding a young 17-year-old girl named Tina who was brought into the outpatient clinic by her parents. They explained that she had developed slowly progressive clumsiness over the last 6 months. She was displaying prolonged, repetitive muscle contractions that may have caused twitching or jerking movements of the body or body parts. They also noticed her speech had begun to slur and her ability to walk was deteriorating. They also noted excessive salivation. Tina had jaundice a little over a year prior to her visit to the outpatient clinic, and it lasted about 4 months, then spontaneously disappeared. At the time, a medical workup did not reveal a clear determination as to why the jaundice occurred. No evidence of liver failure, diarrhea, itching, vomiting of blood, or altered mental status was noted. Upon later examination at the outpatient clinic, She appeared mildly jaundiced, with dark brown rings around her periphery of the iris were found, and neurological exam revealed slow thinking, slurred speech, loss of muscular movement, and a fine resting tumor. Her liver was also enlarged, but not tender. The dark brownish rings, jaundice, and liver enlargement made the doctor suspect she had Wilson's disease.